everybody, my name is Kelly and I'm from the Pennies for Patients program. And what Pennies for Patients is it's a part of the Leukemia Lymphoma Society. And leukemia and lymphoma are the two kinds of cancer that we help raise money for with Pennies for Patients. And where these cancers occur in your body is in your blood. So these are blood cancers. So the first thing we're going to do is we're going to find a little bit about where these cancers begin. So I want everybody to take your arm and I want you to put it up like this. And I want you to feel your arm. And I want you to feel what's inside of there. There's a whole bunch of stuff inside your arm, but what we're going to talk about is the bones. And deep down inside your bones is your bone marrow, and that is where blood cancer starts. So it's when something goes wrong with someone's bone marrow, which is the sponge-like substance deep down in their bones. And with the Leukemia Lymphoma Society, what we do is we raise money for two things. We raise money for research and to help patients. So with research, what we're doing is we're giving money to doctors to help us find better, faster, easier cures for these blood cancers. So right now everyone here is in 3rd, 4th, or 5th grade, right? And when someone gets blood cancer, the treatment process right now is up to 3 years. So 3 years from now, you will all be in 6th, 7th, and 8th grade. That's a long time to be going through cancer treatment. So what we're trying to do, and what we need your help with Pennies for Patients, is to raise money so we can make the cancer treatment process a little bit shorter than 3 years, and also maybe help people so that they don't even get this kind of cancer anymore. And the other thing is to help patients. And what we do with that is, since leukemia is the most common form of cancer in kids under the age of 20 years old, we like to help them with all the different things that they have to deal with when their families have someone who has one of these blood cancers. So when a child gets blood cancer, they don't like to do things like go to school every day or play with their friends or be outside or do all those things that you like to do every single day. And they also have to spend a lot of extra money to go to the hospital all the time for their cancer treatment. So what we like to do is we like to give them money for things like the treatment that they have to go through, or to buy gas to get to the hospital, or the food that they need when they're going to be eating lots of meals out because they spend so much time at the doctor. And then we also help them to meet other families that have gone through the same process so that the kids can meet each other and become friends, and they can maybe talk about all the things that they've gone through. So what does cancer mean? Well, what cancer is, it's when a weird cell divides and divides and divides in someone's body, and then it pushes down the good cells so they can't do what they're supposed to do. So I'm going to ask you guys a couple of questions right now. I want you to nod your head yes if you wash your hands before you eat dinner. Good, okay. And I want you to nod your head yes if you cover your mouth when you sneeze. Very good. And why do we do these things? We do them to fight germs. But cancer isn't like a germ. It's not like catching a cold or catching the flu. It's not something that you can catch. So if you know someone in your class or that you're friends with, or that you know from school that has cancer, a blood cancer, or any kind of cancer, it's not something you can catch from them. And it's probably a good thing that you're friends with them because it will add something positive into their lives. And like we talked about before, we don't know what causes blood cancer, and that is why we do all of this research to try to find out what is causing it. Okay, so what we're going to talk about now is what happens to your body when someone gets blood cancer. So there are 3 different kinds of blood cells in your body: the red blood cells, the white blood cells, and the platelets. And they have 3 very different jobs. So what the red blood cells do is they carry oxygen all the way through your body. And when you have oxygen in your body, you have lots of energy. So you can run around and you can play and you can just keep going all day long. But when someone has blood cancer, their red blood cells aren't working properly. So they don't have a lot of energy, and they like to sleep a lot, and they just don't like to play as often, and they just kind of want to sit around and not do as much as they might if they didn't have one of these cancers. The second thing is anybody remember? White blood cells. Very good. And what the white blood cells do is they fight germs. So like when we cover our mouth when we sneeze, or when we wash our hands before dinner, we're fighting the germs so the white blood cells can keep doing their jobs. But again, with the blood cancer, the white blood cells can't do their job properly. So these people get sick more often because their white blood cells aren't able to fight germs and fight infection. The third one, again, is the platelets. So what the platelets do is they clot your blood. So if you're running around on the playground and you fall down and you scrape your knee, will you bleed forever? No, probably not. You're not going to bleed forever. But if someone has blood cancer, their platelets don't work correctly, and then maybe their blood won't clot properly, and they'll bleed a little bit longer than they normally would, or they'll maybe get nosebleeds more often than they should. So now that we know a little bit about what happens to someone's body when they have blood cancer and what happens to all of their blood cells, let's talk a little bit about honored heroes. I'm not sure if you guys remember honored heroes from maybe last year doing Pennies for Patients before, but once you guys get started, you'll see these big yellow posters around the school, and they have pictures of kids on them. And all of these kids are from Minnesota, North Dakota, and South Dakota, and they've all gone through this cancer treatment process that we've been talking about. So since all of these kids have gone through this treatment, we like to put them on posters so other kids like you can see them and learn a little bit about these kids who might be the same age as them. And I want you to look out for 3 specific kids. There are 3 kids on the poster for sure that are in 3rd, 4th, and 5th grade. I want you to look for Luke, Mackenzie, and Paige. And they are 3rd, 4th, and 5th graders, like I said, who are all from Minnesota who have gone through this treatment process. So maybe you can take a look at their pictures and all the other pictures of the kids and learn a little bit about what they've gone through in the cancer treatment process and help to make them feel better by raising lots of money for Pennies for Patients. All right, so you guys are getting started today with your Pennies program, and I hope now that you know a little bit more about what we're raising money for, you can do a great job and bring in all your spare change. Good luck!